Hi class. This is a lecture beginning on chapter 10, venipuncture procedures. We're going to talk about objective number 1, which is to describe the steps a healthcare worker should take in preparing him or herself for a venipuncture procedure. So are you ready? First of all, we need to be professional. A professional is someone who can do his best work when he doesn't feel like it. We need to dress professional. Make sure to follow your facility dress code policy. And now on page 310, we will start with the blood collection. Several essential steps are part of every successful blood collection procedure. This chapter discusses the blood collection process in the same order as these steps. Each healthcare worker establishes a comfortable routine, even though some facilities vary the sequence of steps based on the characteristics of its patient populations and the type of healthcare setting. Steps may occur simultaneously, for example, while the healthcare worker is introducing him or herself, as he or she begins to visually assess the patient's physical disposition. A problem may arise that precludes the healthcare worker from going further in the procedure. For example, the supplies needed for the venipuncture have expired, or the name given verbally by the individual does not match the printed documentation. Healthcare worker preparation. Before performing any type of specimen collection, the healthcare worker should have access to PPE, phlebotomy supplies, test requisitions, writing pen, and appropriate patient information. Make sure you also have your other equipment available, such as your blood pressure cuff and stethoscope, depending on where you work. If not fully protected with PPE, there's a greater risk of healthcare acquired infections being transmitted. If the patient information is incomplete on the test requisition, the healthcare worker may not be able to identify the patient correctly, or the worker may not know in which tubes to collect the blood. If the healthcare worker does not have the correct phlebotomy supplies, the procedure should not be performed. Workers must learn to seek assistance from authorized resources, including a laboratory supervisor or a nurse, before collecting the sample if there's any deficiencies in the preparation stage. The healthcare worker needs a positive professional mental and physical disposition before beginning the patient encounter. A clean, neat appearance instills confidence and professionalism. A clear and open mind, free from distractions, aids the healthcare worker in successful dialogue with the patient and promotes positive patient rapport and more effective listening skills. If you don't look professional, patients may think that you don't know what you're doing. And if you're distracted, for example, eating something, chewing gum, talking on your phone, talking to others, watching TV in their room, etc., or listening to music, patients may feel you're likely to make a mistake, and this increases their fear and anxiety. We're going to stop there for today. And so your assignment is going to be to make a reference card or sheet of the basic steps involved in a venipuncture process. These steps include numbers 1 through 17 on page 310, and you may also see figure 10-1. You can design your flowchart any way you want. Be creative with it. This is to help you to study as well as for you to have with you all the time as a reference. Make sure you include all of the correct steps in order. And then you're also going to read procedure 10-1 on page 312 through 314. Read box 10-1 on page 314 and procedure 1-2, should be 10-2, sorry, on page 315 through 316. A few reminders. Remember to anchor your vein from below using your thumb. You're going to insert your needle at an angle of 30 degrees or less. And remember to label your samples at the bedside. You've got what it takes to do this, guys. See you next lecture.